Okay, hello everyone. I think we can start the session slowly. My name is Asli Heitzer. I'm a senior project manager at the Global HIV Vaccine Enterprise of the International AIDS Society. And it's my great pleasure to welcome you to this satellite today. I would like to introduce our panel chair, Linda Gale Becker from the Desmond Tutu Health Foundation. And we are talking today about shaping the future, unveiling Africa's role in the HIV vaccine research and the dynamics of domestic funding. And the aims of this satellite are to see what the future of the HIV vaccine research in Africa is, and to discuss and identify benefits and challenges of African domestic funding. And with that, I hand over to my very successful chair, Linda Gale, who's going to give a short pitch why we need that.
Thank you, Asli. It's a real pleasure to be here, and thanks everyone for attending. I hope you're all enjoying a great conference. There is no doubt, and I think this morning, if you were in the plenaries, I think it really highlighted the most recent pandemic we've all had to live through. I think has really brought home more than ever before that regional self-reliance is absolutely key and critical, particularly at the time of pandemics, but I think, overall. And what we're going to explore in this next 45 minutes is, first of all, how that can be done, why it needs to be done, and what are some of the challenges and barriers to being able to do that. So I think, in some ways, if there's any silver lining to the COVID-19 epidemic, it was really the recognition that, and here we want to pay tribute to Africa's CDC and to a number of different agencies, including the WHO, to recognize that this is something sorely needed, particularly on our continent, and really to explore how that can be feasible in today's climate, when there are many other priorities. But we know that vaccines in particular are the cornerstone of our public health response to many communicable diseases. And this continent, we battle with the burden of communicable disease. So that reliance, that self-reliance, I think is something we really champion and want to see more of. Not least to say, the world needs an HIV vaccine, but Africa in particular needs an HIV vaccine. And so I'm really pleased that the Global Vaccine Enterprise recognizes that and has been championing that. We've really been exploring what manufacturing capability there is and how we can help to really advocate for that. So I'm delighted to have a terrific panel today and some wonderful speakers to really highlight some of these aspects. So back over to you, Asli.
Okay, so I'm not sure. Okay, we are going to start with Rosemary from Waki Health in Kenya on a presentation on empowering African HIV vaccine research through domestic funding. And I'm looking forward to your presentation.
Thank you so much. I don't know if it's working. I'm going to have to use this because I have some slides. So this is it, and it's a conversation whose time has come. Not that it has just arrived. It's been here in terms of we have needed to do this years back. A conversation around thinking about all right, maybe I just need to stick to this. Maybe I just need to stick to this.
Can you see that one? Can you see that?
Yes, I can see. Let me see if I can click. Yeah. Perfect. Awesome. Yeah. Sorry?
Point it there.
Here?
Yeah.
Oh, okay. Like that?
But sit and speak here.
All right, guys. Let's see. All right. Yeah, it's good. Yeah, so thank you so much. I wanted to say that the conversation is long overdue. Its time has come, and it's a conversation that we should be having, not just starting now, but over the last few years, because we have seen the shrinking external funding. And not just because of that, it's also because we are thinking about shaping the future and thinking about Africa's research agenda, and knowing too well that if we are going to shape Africa's research agenda, you cannot do that if 100% of your funding is coming from outside of the region. And that's why I think it's really important to have conversations of, but how do you actually move towards domestic funding for HIV vaccine research? I'm going to share with you reflections from a study we conducted. So Waki Health coordinates the Africa Free of New HIV Infections Network. We call it AFNI. And AFNI is part of the coalition to accelerate and support research, prevention research. And it's a partnership with a number of organizations, including APA in South Africa, NAVMAS in Nigeria, and we are funded through a coalition and working with AVAC as our partner, among others. And so we did look at 4 countries for this. And the purpose for this was to use the lessons. Just a minute. Let me get mine here so I can follow this as I click. The purpose for this work was to use lessons from existing health R&D investments to shape strategy and advocacy for increased domestic investments in health research and development. And when we started this piece of research and work, the initial idea was to not look at health R&D, broadly speaking, but to look at HIV R&D in terms of investments and domestic investments. But the interesting thing, or one of the saddest things, is that even the data to get you that research was so scanty, in the region, in terms of it's really difficult to actually track the domestic investments into HIV prevention research. And so we actually had to expand the scope of that work to not only look at HIV-specific funding, but to basically look at the health R&D space and the infrastructure around that. And so this is really the case for African governments to take a stronger role in promoting health research and development, and in the mobilization of resources for such, is so that it's strong and it's multifaceted. And this conversation needs to be situated even outside of just, health, and outside of HIV, outside of health, to think about Africa as a growing region, to think about Africa's, when we talk about localization agenda, when we talk about global health equity, when we talk about making sure that Africans are not last on the queue when it comes to accessing products, whether it's, and in this case, for the purposes of this conversation, we are talking about HIV prevention research. And so making sure that when we have that product, Africa is not the last on the queue, as we have seen with COVID-19 vaccines. It is also what we saw with HIV treatment many days. So it's about financing, but it's also about where do you situate Africa within the global health architecture. Okay, let me see if I got this right. All right. Yeah, so the thing is to say that I don't think we are very surprised to know that when it comes to health financing, broadly speaking, and HIV financing in our region, there's inadequate financing of health across all countries in the region. We know that for you to actually have a conversation of health investments at the country level, from a civil society point of view, we work with the regional targets. So we know, for example, our governments have committed to, committing 15% of their total national budget to health. So even before we can get down to disease-specific allocations, we know already there is a gap even within the sector. We also know that there are other indicators like 5% of the GDP, which basically says out of a country's total revenue, how much should go to health. So this is to say that we have a challenge and there is a huge funding gap. And if we are to think about empowering Africa's HIV vaccine research through domestic funding, we have a lot to do, because even, health itself is being deprioritized, in our countries. So noting that only very few countries are actually making progress to those kind of commitments. The other thing I want to mention is, so that is in terms of health in general. Now, if you go to financing for health R&D across Africa, one of the things we use to hold governments accountable is the 2% Bamako commitment. The 2% Bamako commitment says that African Union member states have committed to deliver 2% of their GDP to R&D, and so as something they have committed to, and so to research. Very, very few countries are doing that. And so this study was also investigating, why are countries, other than the fiscal space, why are countries being challenged, in terms of prioritizing and making domestic commitments a reality? And one of the things that come to play within this study is the research environment in Africa. So you have the funding. Sorry, I forgot to move, yeah? Yes. Okay, so we, oh my God. This is the status, inadequate funding for health across the countries. Yes, so the chair is been very helpful here. So we've gone through this inadequate financing for health across. If you go to the next slide, it's talking about, please go. It's talking about the fact that why it's difficult and why governments are not actually doing that. One of them is the environment, the research environment, legal and policy architecture of research and development. So we are talking about, how do you get government to actually do domestic funding for HIV vaccine research? And so generally, the research environment, when it comes to laws, when it comes to the legal and policy environment that actually anchors research, you find that it's lacking in some countries. In our advocacy, when we push for domestic financing towards health R&D or HIV R&D, one of the questions we are asked is, how will the fund be governed? How do you actually govern this funding? Are you going to set up a national research fund? Are you going to set up, like, how do you actually do that? So we found out that one of the things, there are certain structures and policies at the country level that that can actually help to facilitate, or a country to accelerate shift and progress towards domestic financing. So for example, clarifying what is the institution that is going to govern the funding. For example, next slide. The political will is definitely very important, because right now we are not only struggling with a shrinking fiscal space where governments are having to struggle between paying debt, between investing in infectious diseases, between responding to pandemics. And so when it comes to R&D, a lot of governments don't really see the value, like what is the immediate value of research? Like, why do we need to invest in an HIV vaccine right now? That's a conversation that they are not listening to. And so making the case and rationale for this is very
Can you hear me? Can you hear me? Sorry, confirm that you can hear me. Hello? Can you confirm that you can hear me? My time is running. Hello, can you hear me? Nobody is talking. So I'm muted. Can you hear me? Hey. Hello? Hello, can you hear me? Can you hear me? I'm speaking. What's going on? Hello, can you hear me? What's going on? Okay. I can no longer hear anybody. This is not. It's why 23 minutes. Let me try again. Is it okay now? Is it okay? Oof, I've messed up this. Is it better?
Actually to Zandile, because this is part of your role, right? In community engagement is not only to transfer findings, advocacy to the community, but community includes our policymakers, our treasuries, etc. So Zandile, thoughts about that, or any other thoughts around some of the barriers?
Yeah, so I definitely want to piggyback in terms of what Agnes is saying. We definitely do struggle in terms of language, because we've understood that, you know, communities are different, right? You can get the language completely correct with a specific community, and you have to then change it all the way when you get to a different community. And that takes resources as well. Sometimes resources that, you know, administrators don't necessarily have. So if we've done a marketing campaign around a specific product, that is all we can do for the specific time. Rosemary spoke very well in terms of, you know, the fiscal constraints of our governments, especially when it comes to really the commitment that our administrators can make. And I think one challenge that I've picked up, especially with regards to resources, and of course I'm going to be biased in terms of community engagement, is we're not seeing a lot of public and, private partnership, really not seeing a lot of that when it comes to definite research. And I'm talking about domestically now, right? I'm talking about in terms of, we are speaking about our youth, we're speaking about our future, we are speaking about, you know, the workforce that needs to go out there. Yesterday I was listening to one of the AVAC advocates speaking about self-care. Right? So where does that actually fit into the bigger scheme of things in terms of the prevention tools, right? Where does research actually fit in terms of us making sure that we've got enough tools, but also an HIV vaccine that does necessarily equate to us having, you know, that future, workforce. So I think that's really a challenge that we need to really push on in terms of saying, okay, we understand you are limited when it comes to resources, but have you actually looked into public? No problem. Have you actually looked in terms of really investing, but having public private partnerships that can actually come in and assist you with that? Thanks.
Okay, good. All right.
We're going to, hello, very nice. I don't know, Asli, if you want to do another quick introduction.
Another very quick introduction. We are glad that we made it to make you join. Welcome to the Victor Venica Board of Directors at the African Vaccine Manufacturing Initiative on the Future of Africa, initiated in Africa-led HIV vaccine R&D.
Thank you very much. And again, apologies for the technology, problems with the technology. I'll try and rush through this, and I hope you will be able to pick up something since my time is almost up. Next slide, please. Yeah, so I mean, I'll be preaching to the choir when I say that an effective vaccine remains key to ending AIDS. But what I think is very critical is that, considering the contribution that Africa is making to the global burden of HIV, Africa really needs to play a very prominent role in research for an effective HIV vaccine. All through the history of HIV, advocacy has always played a critical role in defining and driving HIV/AIDS response from the time of discovery to date. And traditionally, Africa has depended on external sources for its vaccine needs. it's sad to say that less than 1% of Africa's vaccine needs are produced locally. And so getting African government to support HIV vaccine R&D agenda will require strong, consistent, long-term advocacy. I heard Rosemary very well, and she made a lot of points, especially something that everybody wants something very tangible you can see. Advocating for HIV vaccine when there are other prevention methods available would be very difficult to convince our African leaders. But this is very important, and that is why where HIV vaccine advocacy comes in. Next slide, please. So, between 2006 and 2012, several African governments developed national HIV vaccine plans to catalyze involvement of their respective countries in the global HIV vaccine research and development enterprise. But these plans were rarely implemented, apart from setting up some committees. I actually carried out a brief survey on that a few years back, and somebody recommended that, well, they were just developed because people asked them to develop it. In other words, it was never owned by the African governments because it was driven from outside. And so they decided to just do it to satisfy those who provided the funds. And at the end of the day, it gathered dust in the shelves. It wasn't implemented. And so the purpose for it was lost. Today, the national HIV response of many African countries has still been largely funded from external sources. And it has been known from the beginning that the search for an effective vaccine will be a long-term venture, and so there has not been surprises that right now we still don't have an effective HIV vaccine. However, we know that with the recent advances in technology, there is hope that this may happen soon. And you can see I put this soon in quotes because we don't know how soon that may be, because there are several capacity gaps, which include scientific gaps, legal and regulatory needs that has to be fixed for us to get to where we really want to go to get to. Next slide, please. Now, one thing is very clear. It's not that African scientists are pushovers. No. And like Professor Happy said in this quote, says African scientists have always demonstrated their capability to take charge when opportunity calls and resources abound. And if we really look at what happened during the COVID vaccine, even though many of our African heroes were unsung, yet there are many African scientists that really made breakthroughs during the COVID, when at the heat of the COVID. So I don't want us to feel that because we have those capacity challenges, it means that our African scientists are pushovers. No, it's just a challenge of resources, which is why this advocacy for support from African countries is very important. Next slide. There is a huge gap, and that huge gap relates to leadership in HIV vaccine research and development advocacy in Africa. There is a lack of strong leadership in HIV vaccine research and development advocacy in Africa, and this is a very major impediment. Since the advent of HIV, superior arguments have always driven the response by governments and philanthropists. In the case of South Africa and how they turned around the HIV response is very clear, and it remains a case study for anybody who is very interested in how advocacy can drive response to HIV. The current vacuum in HIV vaccine R&D advocacy leadership in Africa is contributing to poor country ownership and accountability by African governments. A strong, focused, sustained, long-term, high-level advocacy at the regional and country level is required to induce African governments to take interest in HIV vaccine R&D. Unfortunately, this level of advocacy, and I have no apologies for this, this level of advocacy has not been allowed to thrive because of ambiguity and prevarication in the support for such Africa-led efforts. We see a lot of support, but when you interrogate this support deeply, you find that the support are not really there. The current pulsatile, largely ambivalent pockets of advocacy activities in Africa cannot do the job. And this has been proven over the years. And there has to be a change if we really must drive it. African governments need to hear this message, and they need to hear it from their own people. Next slide, please. Now, in as much as I have said some things that appear depressing, but I believe that there is a better future ahead. And some of the potential game changers for the future of HIV vaccine R&D are the advancements in vaccine development technologies I've mentioned, the establishment of global mRNA technology training hub in South Africa by WHO, the establishment of the PAVM, the Partnership for African Vaccine Manufacturing by Africa CDC, increased collaboration among several entities, including PAVM, national pharmaceutical agencies, and independent private companies. The establishment of the regional bodies like African medicine agencies, which will hopefully will help even with our regulatory issues. And then the leadership role of African Vaccine Manufacturing Initiative, AVMI, that has more than 10 years of advocacy for local vaccine manufacturing. The point here is that COVID brought some realities, which we already knew, but it emphasized some realities, and those realities help to change some things, hopefully. Many African governments seem to be sitting up and trying to take the bull by the horn. But how far will they go remains to be seen. But then we can best hope. And PAVM seems to be a very good platform that can provide this leadership. And organizations like AVMI, which I also am a member of the board, has been playing this role for the last 10 years. And we seem to be making some very good progress. But again, let's see what the next 10 years holds for local vaccine manufacturing in Africa. Next slide, please. I'm happy to discuss more of this if there is still time. I'm trying to rush to finish up. So the future of HIV vaccine in Africa, to me, is bright. PAVM is mobilizing stakeholders across Africa and beyond for local vaccine manufacturing. The HIV vaccine community should key into this for the benefit of HIV vaccine R&D. HIV vaccine advocates cannot afford to work in silo. We need to key into the African CDC. We need to key into what is happening right now in the ecosystem, the vaccine ecosystem, and work with the organizations there. For example, AVMI. Right now, AVMI is focused on local vaccine manufacturing, but then it's a very good platform. It's been there for 10 years and has built a lot of social capital that can be used to drive this locally. And I think that if HIV vaccine advocates can key into AVMI, for example, they can drive, they can help to change the direction, or rather piggyback on what AVMI is doing to advocate for HIV vaccine R&D. And I think that there is a chance that it's going to succeed. The scope can be improved. The task ahead requires a long-term Africa-led multi-stakeholder agenda that allows for scientific potential actualization and local ownership. And like I've already said, AVMI is providing some leadership, but is currently focused on local vaccine manufacturing. The HIV vaccine community can get involved and make a case for the expansion of the scope to include HIV vaccine R&D. Above all, the 3-point agenda articulated in 2014 is still relevant today, and I'm summarizing it in the next slide. Please, next slide.
So, Chief, we're going to call it, if that's okay. I'll tell you why we're running a little bit out of time. And Rosemary did cover some of that. So can you stay on the line? I'm very apologetic. These 45 minutes do disappear very quickly. And we had our technical difficulties, but I want to appreciate that you're there. And we want to give the audience a bit of time to ask some questions. So I'm just going to finish going through the immediate panel to just really turn to you, Thandi. I think what we've heard, there's some barriers around how well we communicate with our governments, community involvement. I think you are making a very strong call for community to advocate. I'm not going to draw in the foundation that has played such an important role in vaccines. I know, for example, Gates was there when Gavi was formulated, and Gates is footing the bill for a large TB vaccine trial that's about to take off in all over Africa in the next little while. But Thandi, your thoughts from sort of the donor perspective or as a third party role?
Yes, thank you. So privileged to be among my esteemed colleagues coming from different perspectives. I just want to emphasize something that that was said. I think there's a two-part role that the science community can play. Number one is the issue of African scientists and visibility. So I think sometimes it's lost among the research community at large, the very innovative science that is being done here in Africa. So one of the things that we need to do is really work to uplift and spotlight some of the innovative work that's being done in this region. And some of that can be done on the local level, from convenings, scientific meetings, making sure that we invite key people to those meetings so that they see that there are people to invest in within their own countries, within their own regions. So African scientists' visibility, I think, is one key area that can be focused on and can run the gamut from the local to the international level. The second is this issue of research ecosystems. So I think too long there's been so much of a north-south kind of reliance, but really there's, again, significant innovators here on the African continent that really can work together to strengthen that local research infrastructure that I think will be very attractive to investors, be it from the international level to the local level. So really trying to do a better job to make that coherent story that our community advocates can lean into when they go before politicians, et cetera, to be able to point to these researchers are here, they're doing good work, how can we better support them? Because that ecosystem, we know that an HIV vaccine may take a while to get to that ultimate success, but you build off of that success. We just had the release of an effective malaria vaccine. We have a TB vaccine that seems very promising. So these are diseases that people have worked on for many, many decades. And it shouldn't be the case that we should be afraid that putting these long-term investments won't have some short-term and long-term benefits.
Thank you. Brilliant food for thought. So I'm going to really invite the audience to step forward. If you could put your hand up, and if you can keep this to just short, sharp questions or comments, that would be helpful because we are short on time. So if anyone has anything they want to say, I'd welcome that if you put up your hand. But maybe in the meantime, I'll turn to you, Rosemary, to say, what I heard coming through strongly from WASI Health is this holding government accountable to, things they've said around particularly domestic funding. How exactly do you do that? I mean, what is the strategy that you think is there any evidence of things that have worked, or what are the possible things that we could do more of?
Yeah, I think there's power in the voice of communities and civil society, and continuing to demand for investments in vaccine research is important, that it's coming from communities and civil society. It's coming from people. I think Chidi was also saying that we have to increase this demand because if left alone, there are so many other priorities that the government can invest in. And sometimes it's not that the government doesn't see the need to invest. Like, our countries are really struggling in the fiscal space, but how do we maintain a conversation to say, yes, but if we don't invest here, it's not going to help our country. I know there are some, like in Kenya, for example, through the National AIDS Control Council, a couple of years ago, we were able to come up with a national research agenda that actually committed to a 2% allocation. And so starting with having a strategy and then identifying how you are going to raise that are like key milestones and key steps, because you won't be able to increase that, first of all, without the strategy, then without the policy commitment. So for us as advocates, it's not just like calling for, we want the money, but also let's put the structure in place, the strategy, the commitment, and so on and so forth, and then accountability for how resources are utilized.
Yeah, and then I really love the call for sort of private-public engagement. So I'm going to pose a question if I don't see hands. Oh, I do see a hand. Can somebody perhaps get a mic? That would be great to hear from the audience. Or in the interest of time, if you can stand up and bellow, it would be great. No, you have to bellow more. We can't hear. Sorry.
Okay, good afternoon, and thank you very much for bringing up a very interesting topic to us. So my question is, given the experience that we now have as the scientific community, do we have any research organization or any research team that has some sort of a timeline as to when we can expect the vaccine to be out? It can as well push or encourage the governments to come into funding of this.
So that's wonderful. I wonder if anyone wants to tackle that. Do we have anybody who's been brave enough to step forward and say, I have a winner. I think this is when we're going to see a vaccine. I think it would be, maybe I'll speak out as somebody who's in the business, that a brave person to say that. But I think there are groups who are now really grappling. You know, IRV, the advanced group has been, and there definitely is some work underway. You may be aware that we've had some setbacks in terms of the sort of empirical approach to finding an HIV vaccine. I think we are sort of back at the lab, but as Chidi and others have said, there's no reason why we should not be upstream in terms of the vaccine discovery. We've been quite downstream. Glenda showed beautifully this morning, we've done 705, 702, numbers of large trials, but there's no reason we shouldn't be playing a more important role upstream. And maybe what I'll say is there's lots of promise around a new strategy to move towards broadly neutralizing antibodies and working our way. And certainly the advanced team is moving that forward. And I'm very pleased to say the brilliant consortium that has now just been formulated. But I think there are other groups, great groups also in West Africa and so on, who are looking at new innovation to move this along. I think it's quite a brave person to say, by such and such a time, we'll have a vaccine. I think historically, Clinton said that about 20 years ago, and you know, he put a time to it, and I think he's regretted that. So it's not an easy vaccine to find. Let's put it that way. But important, obviously, everything we have learned to date, we're putting into the mix to say how do we move it forward. So thank you for that question. I think there was another question. Yourself, did you have your hand up?